Hello, everybody. My name is Jonah Wiley, and we are going to be talking about advocacy for veterans, mental health, and policy reform. This assignment is evaluating advocacy video presentation, and my population and topic that we are talking about is veterans and their mental health and possibly the policy reform. So, without further ado, let's get started. Veterans, a resilient but vulnerable population. The cultural aspects of veterans often share a strong sense of discipline, honor, camaraderie, and loyalty. Military culture values service, strength, and sacrifice, which shapes their worldview and coping mechanisms. The challenges facing with this population is many veterans struggle with PTSD, depression, substance use, chronic pain, and difficulty in reintegrating into civilization. Barriers include the stigma, wait times, long wait times for care, and limited trauma reform services. The resiliency factors include peer support networks, structured routines, purpose-driven outlooks, and access to veteran specific services, which is like VA centers, nonprofits, and they help many veterans manage adversity and maintain strength. Adversity and maintain strength. Sorry, excuse me. The historical and current marginalization of veterans, the historical context behind veterans. After major conflicts like Vietnam, many veterans return to little or no support, often facing public resentment and limited access to mental health. The systematic neglect is the stigma around PTSD and invisible wounds, which led to underdiagnosed and untreated conditions, homelessness, and substance use rolls among veterans. Monitoring progress. So post 9/11 efforts have improved awareness and funding, including the expansion of the VA and veteran outreach services. Ongoing issues include veterans still facing long wait times, care inconsistencies, and challenges in accessing trauma-informed and community-based mental health care. Social policy impact on veteran well-being. At a local level, so I live in Nashville, Tennessee. So I'm following the Nashville, like Tennessee statewide thing. So Nashville, at the local level, Nashville Vet Centers offering readjustment counseling, housing resourcements, and peer support groups. At the state level in Tennessee Department of Veteran Services help connect veterans with benefits, health services, and crisis intervention resources. At a federal level, the VA Mission Act in 2018, it expands the access to community care and strengthens VA infrastructure. The PACT Act in 2002 provides benefits for veterans exposed to toxic substance. And the Affordable Act, the Affordable Care Act includes mental health parity provisions, expanding coverage for mental health and substance use. So we're going to my advocacy plan, expanding the trauma-informed veteran care. The advocacy goal is to improve the access to trauma-informed mental health services for veterans. Um, the target audience is state legislators, VA leaderships, and local community stakeholders and veteran families. The core strategies include develop and distribute policy briefs, emphasizing the need of trauma-informed care. The host community reforms and veteran town halls to amplify lived experiences and build coalitions with veteran servicing nonprofits and advocacy groups. All right, next slide will be the social media campaign that I worked on while in this class. The hashtag is Act for Veterans. Campaign hashtag is Act for Veterans. The goal is to raise awareness about the mental health needs of veterans, reduce the stigma around seeking help, and mobilize community support for trauma-informed care. Platforms that will be used will include Instagram, Facebook, Twitter. I can even put TikTok, other platforms on the internet or online out there that can help spread the word. Key tactics include share veteran stories and statistics on mental health challenges, post short videos explaining trauma-informed care, use calls to action, informing and encouraging followers to contact legislators and share content. So survey questions and administration plan. So I had a couple of survey questions that I done with this population, and I'm going to share them with you. But the purpose is to assess the gaps in mental health services for veterans. Some I listed five here. They include: what is your current military status? How would you rate your overall mental health? Have you faced challenges in accessing mental health services? What type of mental health services would be beneficial for you? Do you feel that current policies provide inadequate support for veterans' mental health? The distribution plan that I came up with would be sharing via social media platforms and email lists, distribute to VA centers and veteran support events, and kept anonymous in under 5 minutes to encourage participation. So survey results and identify community needs. So key findings: 60% reported that current VA mental health services do not meet their needs. The top barriers include long wait times, transportation issues, and stigma. 75% expressed strong interest in mobile mental health units. Community needs identified: more accessible, localized mental health services, expanded trauma-informed care, outreach programs to reduce stigma and raise awareness, and additional peer support and transitional programs for reintegration. Now let's talk about evaluating advocacy efforts and lessons learned. So I have the evaluation strategy. I use the logic model framework. Inputs include time, research, reaching materials. Activities include policy briefs and social media and survey distribution. Outputs include number of people reached, survey responses, community engagement outcomes, raised awareness, identify service gaps, informed advocacy messaging. The lesson learned is that I learned is collaborating with veteran groups increased credibility, and visual storytelling was powerful for engagement. The barriers that I faced include low initial survey participation, required expanded outreach, limited time and resources, restricted media reach, and data analysis was slow due to inconsistent survey feedback. So the impact, the next step: advocacy impact so far. So we increased the dialogue among local veteran groups. Social media campaigns reached over 1,000 viewers. Survey data will inform future community participations and policy briefs. Next step: present the findings to Tennessee Department of Veteran Services, expand partnerships with rural veteran centers, and apply for grant funding to pilot the mobile mental health units. And call to action: what you can do. Share the hashtag Act for Veterans message. Contact local law makers about veteran mental health fundings. Support organizations providing trauma-informed services. And the final thought of when it comes to veteran care: veterans fought for us. Now it's our turn to fight for their rights for healing and care. Next will be the reference page and some that references that I used to form within the PowerPoint. Really couldn't get like some of the quotes onto the PowerPoint because I wanted the information detailed on the slides. So thank you for listening and hearing my proposal and listening to my presentation. And thank you and have a blessed day.